Good afternoon. Welcome to day 328 at the EMA office, where I'm joined with Chairman Kern as we go over the numbers. But before we do that, we have a very special guest joining us today that I think is going to be very interesting.
We sure do, Herb. We're lucky to have joining us today Dr. Pablo Echevarria. He is a critical care specialist at HSHS St. Elizabeth's Hospital. Doctor, welcome.
Thank you. Thank you for having me.
So Doctor,
Happy to be here.
let's dig right in. Tell me, how is the ICU staff handling this in general, and then talk about the patient load and what you're seeing in the hospital right now?
Sure. It's been it's going to be close to a year since the pandemic started and hit the country and Illinois. It's been very, very unique at times, for sure. ICU staff-wise, we're doing pretty good. As you can imagine, people are overwhelmed and tired, not just physically, but mentally. We've seen a lot of sick people over the last year, and that's going to impact for sure on everybody's life. However, I'm very proud to say that, the staff at St. Elizabeth Hospital, not only the ICU, but the emergency department and the whole hospital, it has stepped up and it's doing a fantastic job with taking care of patients with COVID.
So there are some people that are hesitating to take this vaccine, and maybe we can start that conversation about how bad is it when someone gets COVID and ends up in the ICU? I mean, that has to be the first and foremost thing in people's minds if they're weighing whether or not to get the vaccine. Is what possibly could COVID do to me?
Correct. That's what most people don't see, and we get to see. Even family members of people who get very sick don't get the opportunity to go and see and visit their loved ones. People get very, very sick, and what I mean by that is people get a severe form of respiratory failure, and they're basically drowning in their own secretions and fluid. And they get very hypoxic, what we call hypoxic. The oxygen levels are very, very minimal, that are almost incompatible with life. At that point, several organs are going to start being affected. And at that time, even with the supplementation of oxygen at high concentrations and high flow, using very unique equipment, some people get even worse and don't get better. At that point, the last option for us is to put those patients under mechanical ventilation and put them to sleep. Sometimes we have to sedate them and paralyze them to take full control of the breathing. So by putting a breathing tube down their throat and connect them to the ventilator, people will be assisted to the machine or by the machine for a long time until hopefully they recover from the actual illness.
And unfortunately, many times people do not recover.
That's correct.
And so we do have an option to that. We have a Moderna vaccine and a Pfizer vaccine that are currently being offered. Can you talk about those and the rates of immunization that they give a person?
Absolutely. So as we all know, Pfizer, like you said, and Moderna have been approved by the FDA. Both pharmaceuticals and both trials have very, very similar results, 94, 95% efficacy, and they're very safe. People who opt to get the vaccine basically are gonna be protected by the immune system. What the vaccine is going to do in your body is there's a very, very small particle of a genetic code that is going to be injected into your body, and it's basically going to tell your cells to go ahead and produce some protein that the virus has on their capsule. So basically what you're going to do is you're going to trick your body and your immune system, and it's going to start saying, well, there's a foreign body here, there's a virus, and we're going to go ahead and start producing antibodies and fight this infection or this virus that is present in my system. So you're going to start producing antibodies to kill this virus. By producing antibodies, in the event that you have a true infection with the virus, you already have elements to fight the infection effectively. And that's basically what the vaccine will do in a healthy population.
And how effective are we at the 95% level with both?
94, 95%. That's correct. So it is very, very effective. Just to have an idea, the influenza vaccine that we all get every year, their efficacy is about 60, 65%. And still very, very good. And we all take it. So these two trials are very well done, very well conducted, and very promising. I got to tell you, I was actually part of the trial of Pfizer conducted by Pfizer. So I was vaccinated back in October as one of the participants. A couple of weeks later, I found out that, yes, I was one of the members who actually got the vaccine. So I was very, very excited. As you know, I've been exposed to, I've been taking care of patients with COVID since last year. So we've been in the front line, and we were hoping to get the vaccine at some point. So it's very, very exciting. We're hoping that all the colleagues, nurses, doctors, people at frontline, and the community in general will decide to take the vaccine and get protected. That's the only way that we're gonna finish this nightmare.
So there are people who are concerned about the safety of the vaccine. Can you talk about that a bit? You've taken it yourself, so you obviously researched it and have put it in your body. Talk about your thoughts on safety.
They're very safe. If you have the opportunity to see a patient who's dying from COVID, or who has been infected with COVID and has been struggling for several days or weeks, and they have very low chance to recover, versus people who are healthy and they have a vaccine available, I don't see why not to go ahead and take the vaccine. They're safe. The only or the most common side effects that you have with the vaccine and have been reported, including myself, is headache, mild, moderate headache, as well as pain or soreness on the site of the injection. Those, compared to what the people who get very sick are undergoing, it's a huge difference. So I'd rather take the vaccine than get very sick from COVID. So I hope people understand that it's very safe.
We appreciate that, and I think that is a point that really cannot be stressed enough. We see light at the end of the tunnel. We have a vaccine. There are treatments available, but what fears do you still have about the virus in the community? We got through Christmas. What about, do we still have infection out there? I know we do. What are those rates, and how do we get through until we get enough immunity in our community?
So yes, the fear is that people will, we're approaching to the Super Bowl, for example, and people will get out, get together, have big parties and gatherings. That's when the virus is going to spread very, very easily. Most of these patients or people who are healthy, they're going to be or they're going to have mild symptoms. They're going to be asymptomatic. So they don't know that they're carrying the virus and they're spreading the virus. They're passing on to the community, to their family members, friends, and loved ones. So that's how you spread the virus. So if we don't take action and we don't keep doing what we're doing, masking, social distancing, etc., after Super Bowl, I wouldn't be surprised to have another wave. So please stay at home. Have small gatherings with your own members of the family in your household. That's the best way to prevent the virus to spread. Otherwise, hospitals are already overwhelmed. We're going to have another wave, and this is never going to end.
If someone has been vaccinated, that doesn't mean that they can't still carry the virus and spread it to someone who has not been vaccinated. Isn't that true?
Correct. So ideally, yes, you want to get vaccinated, but you still have, even after you get vaccine, 2 doses of the vaccine, to reach that point of 94, 95% efficacy, we still have to wait until most of the community, majority of the community, typically 50, 60%, up to 70%, get vaccinated and develop this immunity. You still have to wear a mask, keep your social distancing, wash your hands, keep your hygiene until we see the numbers going down close to zero. It's going to take some time, but it will happen. I'm convinced that it will happen.
So, Dr. Echeverria, we appreciate you being here. Give us one last word. How is this vaccine going to help us get back to normalcy? What message do you have for the community that they need to take a hold of and remember from this today?
Well, the only message is don't be afraid. Scientists in medicine, they have done a tremendous job in putting together this vaccine in a time record. That's the only way that we can prevent from the disease from spread. And people need to understand that the only way that we can finish this nightmare, as I call, is opting for the vaccine and see those numbers getting close to zero. We still have to be patient. This is a new virus. We still have to learn a lot from this disease. In the meantime, the community, people have a lot of responsibility. We're doing our part as a medical professionals, but the community has a lot of responsibility. They need to take responsibility as well.
Thank you, Doctor, for helping the community and for taking time out of your day today to share these great thoughts with us. Thank you very much.
Thank you for having me.
Thank you. Herb?
Well, I think the doctor is going to stick around and speak to the Spanish community when we get through with the daily statistics, and we really appreciate him doing that. Also, we got Brian Whitaker with us today. Brian, you got the numbers for today.
Yes, sir. So for St. Clair County totals, we have tested 260,440. That is an increase since yesterday of 1,769. For positive test results, we've had 26,416. That is an increase since yesterday of 117 new, being males and females under the age of 1 through their 80s. That brings our daily county positivity to 6.6%. For negative test results, we have 234,024. We are happy to report no new additional COVID-related deaths today, so that number remains 423. For those that have completed their 10-day isolation period, we are at 25,005. For state totals, they have tested 16,359,655. Positive test results received are 1,137,559, and that is an increase of 3,328 since yesterday. Unfortunately, the state did report 69 new COVID-related deaths, bringing the statewide death total to 19,444. For hospitalization numbers, for those hospitalized here in St. Clair County, we have 80 patients admitted due to COVID-related illness, and 2 of those patients are on ventilators. For regional hospitals, we have 132 patients admitted due to COVID-related illness, and 5 of them are on ventilators. For our congregate living facilities, and we will announce those that have had changes today, reminder these are cumulative numbers. Integrity Healthcare of Belleville has 97 cases and 7 deaths, and that's an increase of 1 case. And St. Paul's Home in Belleville has 157 cases and 28 deaths, and that is also an increase of 1 case. I'll now turn it over to Chairman Kern for his update.
Thanks, Brian. 260,440 tested. That's about 1 test for every citizen resident of St. Clair County. So
Yes,
that's quite a milestone.
Definitely moving through those, and a lot more that's test still needs to occur. That's one thing that a lot of people are thinking, now that a vaccine is here, testing is not important. testing is still very important. We're sharing that information every day on our page of different test sites. Obviously, the St. Clair Square test site still open 7 days a week, 8 to 4. And as the doctor and you just recently discussed, even someone who has had the vaccine can still carry and transmit the virus onto others. So testing still so absolutely important.
We need to isolate the virus to keep that positivity rate low. So thank you.
No problem.
Okay, we'll go into the zip code report. These are the COVID positive changes in these St. Clair County zip codes. 62201 up 1 today to 548. 62203 up 2 to 575. 62206 up 4 to 1,209. 62207 up 2 to 549. 62208 up 5 to 1,473. 62220 up 24 to 1,874. 62221 up 15 to 2,541. 62223 up 10 to 1,574. 62226 up 10 to 2,901. 62232 up 1 to 830. 62239 up 1 to 422. 62243 up 4 to 684. 62254 up 2 to 744. 62257 up 2 to 321. 62258 up 3 to 948. 62260 up 7 to 727. 62264 up 2 to 333. 62269 up 15 to 2,982. And 62285 up 3 to 510. As Brian said, 117 new COVID positive diagnoses in the county today, 1,769 people tested. That brings our county positivity down today to 6.6%, which then brings our rolling average in turn down to 7.1%, both headed in the right direction. Regional positivity is also down today. It's down to 6.1%. And the way they come up with the regional positivity is to look at all of the counties in our region. Bond County, 4.5%. Clinton County, 8.7%. Madison, 7.6%. Monroe County, 24.8%. Randolph, 2.5%. St. Clair, 6.3%. And Washington County, 7.7%. Herb, things going well at the fairgrounds? You were down there practically all day, making sure everything was working smoothly.
Doing real good. The staff, from the medical staff to the National Guard, everybody, it's just gelling like a well-oiled machine. I got to stand out there as some of the citizens was coming through. Everybody is giving the thumbs up, just talking about how easy it is. Messages on the social media. We're really happy about that. We're really happy to announce, Mila and Sam just sent a message that we're going to be going to the 65 age group and up. So that's really exciting, a little bit ahead of schedule. But the key, as you know, because I know you're on the phone hourly, pushing for more vaccine. So, but that's real good news.
So they need to schedule those appointments, and the scheduling information is up. But now, if you are 65 and older, you can schedule and be available for the sites in the county. Certainly, the mass vaccination site. If you have already signed up, then you'll be contacted, and you'll start to see your turn coming. So now it's really all vaccine dependent. We are getting through as fast as we can with this. I do want to say that we've noticed there are a number of people who aren't showing up for appointments. I want to make it clear that if you set up an appointment, please try to be there. There are always circumstances that you can't, but if you set up the appointment, there is a dose of vaccine that's waiting for you on the day that you've reserved. let's make sure that you make every effort to get there after making the reservation.
Well, and the call center is still in operation to help anybody who's having those problems with doing that. Still go on to the portal on our EMA page and on the health department's page. We're up to 65,134 as of this afternoon, which is an increase of 1,741 since yesterday. So get on there, get your name on the list, and once that vaccine comes, they'll be sending out the emails and the messages to you. And please, as the chairman said, try to make those appointments. We're just under 1,000 a day, what we're trying to do, and we can do more, but we need the vaccine. The site is really set up for those of you who have went through there and shared your thoughts. We appreciate that. Team St. Clair, we just really appreciate what you have done and continue to do because, as you heard the doctor say, and we say it every day, we're not out of the woods yet. We got to keep these numbers down. The doctor mentioned it, the Super Bowl Sunday. Hope your favorite team wins, but try to have a nice little group and keep it small, keep it in your small bubble.
Because we want Team St. Clair to win on Sunday.
Team St. Clair is winning. We're going. That light at the end of that tunnel is brighter every day, and I'm putting all the emphasis on you to get the vaccine for us.
And we opened up today also. Well, we're going to put it on others, but we're all going to work together to bring that vaccine here. But let's talk about the opening too, Herb. We now have the mitigations lifted.
Yes.
The hard work that all of you have gone through, coupled with the amount of vaccine that the Governor's Office and the Department of Public Health have put in the community, along with our friends from National Guard and the Health Department and the volunteers in the hospitals. I can't say enough great things about HSHS St. Elizabeth's and Memorial and Southern Illinois Healthcare Foundation. They've all been a big part of this. And then, of course, the Eastside Health District, Elizabeth Patton is just working.
I was down there with Liz today, and they're working their fingers to the bones, just like everybody is up here. And it's really great to see that good collaboration of teamwork. We talk about 423 deaths in our county, which we've said from day one. One was too many, but the mitigations that was put in place, all the action that we've taken with this coalition we put together, has kept that number as low as possible. I would hate to think what that number would be had we had not done what had to be done. So we really appreciate it. We're going to be back with Cindy in a few moments, and also the fine doctor to translate this into our Spanish-speaking communities. And then we'll be back tomorrow for day 329. Everybody have a good evening.
I was born and raised in East St. Louis, St. Clair County, City of Champions. We band together like family on picket where the Mayor Brown Center in Lincoln Park was my playground. Just as we were together then, we must all band together now and work to combat COVID-19. As an Olympian, I understand the importance of teamwork and overcoming hardship. So I plead with you to do what I'm doing to fight this virus. Wash your hands, wear your mask, watch your social distance. It takes teamwork, and if we stick together, we will victoriously cross the finish line.